Hello Zoe, my name's Dr. Martin. What can I do for you today?
Oh, well, hi. I've got this really sore throat that's been going on for days now, and I really think I need an antibiotic.
How long did you say that? So how many days would you think you've had that problem?
I think it's been about 4 days now, but it's just so sore and scratchy, and it's just so painful.
Right.
It's really bad in the morning, and
Yeah.
it's even worse at night time. And even when I swallow, it gets worse, and when I
Right.
try and talk, it's really, really sore.
Is it stopping you from drinking things or from eating things?
Well, drinking doesn't help at all.
No.
And it's and at work it's just impossible.
Right.
I've also tried all the stuff that you get from the pharmacy, and I just
Yeah.
need something stronger.
Okay. Have you had a cough or a cold recently, or any other problems of that nature?
Yeah, I had kind of a small cold, but it kind of left me with a bit of a cough. That's
Right.
really hurting as well.
Okay. When was the cold? When did you have that?
That's probably last week.
Okay, right, okay.
Yeah.
I think the best thing to do is I need to have a look at your throat and just examine you and then find out what would be the best thing to do for you.
Okay.
Okay?
Okay.
I've had a good look at you. You've obviously got a bit of a red throat. It doesn't seem too inflamed, and I can't see any pus on your throat. And when I've examined your neck glands, they don't seem particularly swollen. I've checked your temperature, and that's normal. And having looked at that, it seems to me that the likely cause for this is a virus, that it's followed on from you having had a cold.
Okay.
And in those instances, we think the best thing to do is try and take things that relieve the symptoms, but we wouldn't normally give you any antibiotics or treatment of that nature.
Well, it's because the last time I had this, I was given some antibiotics, and they really seemed to work. So don't you think I don't need them again?
Now, these days we do try to avoid antibiotics unless they're absolutely necessary, and there's some very good reasons for that. One reason is because they can actually upset you, they can make you feel sickly or actually cause vomiting. Another is that they can cause things like rashes or allergies, and therefore that's not a good thing if they're not absolutely necessary. And then the other problem that we're seeing is that if we do overuse antibiotics, we give people antibiotics when they're not needed, we can get problems with resistance to the bugs. The bugs become resistant to the antibiotics, and therefore when we try and treat people in the future, these treatments aren't going to work. So we are trying to avoid them now.
Oh wow! I didn't actually know that about antibiotics. So.
No.
Well, the only thing is would it be better if I could take the antibiotics and don't take them, but just in case it doesn't get better, then I take them, because I don't know if I can get any more time off to come back and see you.
I think it'd be better if you try to take something that will relieve your symptoms. So things like paracetamol, which help you feel better and relieve the pain. Things like a throat spray, which might help you relieve the symptoms of the sore throat.
Okay.
Also, lozenges with medicines in are really quite useful as well in relieving your symptoms. And if I were you, I would take those for a few days and just see how it goes. The likelihood is it will pass, it will just go away. Most sore throats only last for a week or so.
Okay.
You've had yours for 4 days. I wouldn't expect it to go on for more than a couple more days, and then it should settle down. But by all means, if you find that it's getting worse, if it's causing you severe problems, I'll be very happy to see you again and have another look, and then we can decide whether you do need some additional treatment.
Okay. So I just stick to the lozenges and the spray,
Yeah.
and just basically wait for my body to fight off the virus itself.
That should happen. Your
Okay.
immune system, you don't have any other problems that
No,
I'm aware
no.
of. So
Do you-
I think that it should just settle down and go away.
Okay. Do you think I need some time off work?
That's very much up to you. There isn't any specific need for you to have time off work unless you just feel so unwell or grotty that you feel that you can't continue with your work. But it's not something you're going to pass around or cause infection in other people.
Okay.
Okay.
Thank you. Thank you.